All right, so once I started learning about this vitamin D synthesis thing, I wanted to check my vitamin D level. So I got it checked out in 2013. It's 89. It should be, so I'm just barely in the sufficient. Okay, I'm not insufficient. And when did I get this taken? November. So in November, we haven't gone through the whole winter yet, right? I'm just starting the winter, and already I'm kind of in the lower end of sufficient. And what I started doing was supplementing with vitamin D, and I wanted to see how's that going to change. So there's another biohack. So that was in November, and then in March. So we just went through the whole winter. And also, I should add, I was going into a stand-up tanning booth for 7 minutes once a week. Okay, so not a long time. I wasn't going overboard. I was doing tanning once a week, 7 minutes in the stand-up, because that actually is good for vitamin D synthesis. So I know you've all heard, don't use tanning beds because it can cause skin cancer. Again, don't get burnt. If you get burnt, then you're really increasing your chance of getting skin cancer. But if you use a tanning booth like I did, once a week, 7 minutes, and I'm not getting burnt, then I'm getting some vitamin D synthesis. As well, I was supplementing with vitamin D and eating sardines and things like this. And I did raise it to 104, which I thought was pretty good considering we just finished, or we were sort of finishing winter in March. So I went from, as you can see, 89 to 104. So it's still not where I really wanted it to be, but it's better. Okay, so, and of course, disclaimer again, there could be other factors at play. Who knows? It wasn't a fully controlled experiment. Okay? But any of you, I mean, now we're entering into spring, sort of. We'll be getting into the vitamin D synthesis season now, so just get outside. But maybe this fall, like say November, go get your vitamin D level checked. See what it's at, and then start supplementing, because it's likely that it'll be pretty low. Stretch break number 3. Stand up. Push your chair in. Stand behind it. And again, we don't have that much space. But we're just going to do the calf stretch. So it just sort of put the leg backwards so that you're getting that calf stretch. Hold it for, we'll say 20 seconds or so. Usually I say 30, but 20 seconds. Moving on to biohack number 8. I have about 12 of them, just so you know. Platelets. So, 2 years ago, my knee, after the 2 knee surgeries, was really bad. Because the last surgery I had was like 15 years ago. And it's been really bad, just kind of going downhill over time. To the point where I was getting pain about 12 times a day. It felt like someone was taking a screwdriver and jamming it into my knee. So I figured I need to do something here. And I found this amazing surgeon who's at the Women's College Hospital, and he specializes in cartilage regeneration. So before I was going to sort of shoot for this surgery, I wanted to do a blood test, make sure everything looked okay. And what I found was that my platelets were low. They were actually in the insufficient range. Does anyone know what platelets do? Yes, it helps you clot. Okay, so if, say you cut yourself and you're bleeding, you need the platelets to come along, and those will actually send signals, and you'll get sort of growth factors around there, but it'll also help the clotting pathway so that you can stop the bleeding. And I figured low platelets, surgery, probably not good. So I was like, how can I raise my platelets naturally? And what I did was, and this is where I want to empower you with, you can figure this stuff out yourself. What I did was, I had the blood test, which you can do. I saw the platelets were low. And then I thought, okay, I'm going to figure out what is a component of platelets. And I found out vitamin K. So just simple Google search, what makes up blood platelets. Vitamin K is a really important component. So then I thought, okay, what's the source of vitamin K? Turns out Popeye had good platelets because he was pounding the spinach all the time. And I found out that spinach was one of the best sources of vitamin K. So I started eating tons of spinach. And what ended up happening was, here's my platelet level, and we'll go back in time. So 2010, it was 108. Then it was 2013, it was 129. So it's actually looking okay there. March 7th, 2014, it's 112. That is where I was thinking about platelets. So the other measurements, I didn't pay any attention to platelets at all. Didn't really think about it. But when I saw it was 112, that's where I was kind of like, oh, I've got to do something here. Because look, the range should be 145 to 400. And I'm at 112. So look at this. March 7th, 2014, I started eating tons of spinach. I was putting it in smoothies and eating it in salads. And 3 weeks later, or not even, March 20th, 2014, 161. That's quite an increase for only like 2 weeks or so. Again, disclaimer, could be other factors at play, who knows? But I think this is my most striking example of how you can biohack your physiology. So going from 112 to 161, now I'm in the normal range. I'm in the lower end of the range, but at least I increased it quite a bit there in only a few weeks. Because your blood cells are constantly turning over too, so that's why you can have these quick results. So that made me feel better about going into the surgery. Now my platelets look better. So I had knee surgery number 3 last year, and it was a crazy surgery. I am one of a handful of people who have had this surgery in Canada. I don't know how many in the States. And what they did was they took out the remnants of my cartilage in my knee, and then they took a donor cartilage, so someone who died and donated their organs, they took their cartilage, they had to match it for the right size, and they put it into my knee. It's a long story of how they actually get it in there. They cut out a slot in your bone, and then they take the bone from the donor, and they slide it in that slot. And then they use a bioabsorbable screw to get it down, and then they suture the cartilage into your joint capsule. Not only that, they also did a microfracture, which is up here. They poked little holes in my femur, which is the big bone here. The end of it is all broken down. The cartilage is all broken down because the other cartilage is all broken down too. So what they did was poke little tiny holes in it. So they call that microfracture. And that creates bleeding. And then you're hoping that this new blood and growth factors will repair all of the beat up cartilage there. So not only microfracture, which is a brutal surgery in itself, but they also did the cartilage transplant on me at the same time. So it was brutal. I'm not going to lie. I was on crutches for 10 weeks last summer, and I was here teaching on crutches, and that was hard. And I had very, lengthy rehab, and it went pretty well, but I had moments where I was kind of scared, like, why did I do this? Because basically, look at it this way. I had it done in May of last year, and by September, I couldn't bend my knee more than 90. So I was stuck at 90, which meant I can't even ride my bike now, which is like one of the last things left for me to do physically. So I was getting really bummed out, and I talked to my surgeon about it, and he said, we're going to have to go back in. So we went in for surgery number 4 at the end of September, and he found that there was some scar tissue inside my knee, and that was creating like a block. So he removed the scar tissue, and then he took my knee, and let's say it's like this, he went like that under anesthetic and bent my knee like this. So I was not looking forward to that part at all. I was really afraid of, is he going to tear my muscles? Is there going to be, this was such a delicate surgery, and now we're going to go like this with my knee. So anyway, I woke up from surgery. I had a fat lip, which I didn't know why. Like, did someone punch me, or was this like maybe even though I was unconscious, I thought maybe the pain was so bad that I like bit my lip. But then they said it was probably from the tube that they were putting down my throat. Either way, I don't know how it happened, but that being said, about a month later, it was way better. So now I can bend, not the same as this side, but almost. So I can ride my bike again. I'm very happy. I'm just very grateful that this surgeon was able to pull this off. So it was a brutal surgery, but I got through it, and now I'm riding my bike again. So I don't know how long this is going to last, having this donor cartilage in my knee, but hopefully at least 10 years.